As a GP, it seems like my job is constantly changing. I'm young, but already the field has changed considerably from med school or even my residency. I've always wanted my own practice, and now that I have one, it's important to me that I keep up with advances, not just in medicine itself, but the way we practice medicine. Just about every task I perform in the course of a day has in some way been enhanced or made easier by recent technology. Let me show you what I mean. This is Amanda and her son, John. Looks like John is really sick this morning. Amanda goes online. She has an electronic chart with Relay Health. Through the service, she finds my office. Without even having to make a phone call, Amanda is able to view available appointment times and book a slot for 9:15 a.m. Amanda receives an automated confirmation call from my computer system.
The office of Dr. William.
Now she can call her own office and make the necessary adjustments to her own schedule. I am instantly aware of the modification of my schedule. So when did you start having these bad dreams? As it turns out, Amanda arrives early for her appointment. I'm at the hospital making my morning rounds, but we can still put this time to good use. My assistant lets me know that Amanda has arrived using the remote web camera feature.
Hi, doctor. Your patients have arrived early. They are here in the waiting room.
I instruct my assistant to have Amanda begin uploading John's history using the kiosk in the reception room. I just saved half an hour and I didn't even have to leave my patient. Plus, my assistant is free to attend to other tasks. After my rounds, I can take a moment to peek at John's file. I see he's 7 years old, so I use my electronic fax solution to request copies of his immunization reports and patient records from all of his previous doctors. Meanwhile, Amanda has finished uploading John's history into my kiosk. Now she can sign off on insurance and the necessary HIPAA forms, all of it stored digitally. We have a scanner that records her insurance card, and the credit card reader takes the copay. Both are integrated into my office's computer system. This is key. Everything I do with Amanda and John today will be recorded in my office's computer system. Billing is integrated, so only the correct codes will be sent to my biller based on the completion of the visit. I don't have to worry about under or over coding. Now it's time to practice some medicine. My nurse takes John's vitals and inputs them on her tablet.
Doing any after-school activities?
Now I can quickly review my patient's entire history, including the vitals that were just taken. I see John's had a lot of ear infections. Definitely another ear infection, and probably a case of strep as well. I'll order a throat culture to confirm the strep. This is an important point for me. The software doesn't tell me how to treat my patient. I'm still the doctor here. I call the shots. It doesn't say, don't get the throat culture. It simply reminds me that a throat culture has been taken for this patient in the last 6 months. It gives me all the information I need. Now in this case, another culture is definitely necessary. That's my call. I have to wait for the results of the culture, but I can prescribe amoxicillin for the ear infection right now. It's very important to take all the antibiotics. That's how we prevent worse strain of strep. Because of the diagnosis, I was able to print patient instructions at my front desk. They'll be ready when Amanda and John exit.
Thank you.
Very good patient today. Thank you. All right, you take care. Billing used to be a pain, but not anymore. The fully integrated system sends all the data from John's appointment to my biller, who then passes it on to the appropriate insurance company. Again, everything's in the computer. No overages on their end, and nothing missed on mine. And I can store the information forever in case of an audit. By the time Amanda got to the local pharmacy, John's prescription was ready to go. Now I am done. She was back home by 11 a.m. and able to work from home the rest of the day while she took care of John. Later in the day, she was able to access the patient portal to confirm John's throat culture. Yep, he's got strep. One of the best things about digitized records is easy backup. I can choose to have my records automatically backed up at any facility or facilities across the nation, or I can back it up onto this hard disk and bring it home with me, or all of the above. However I do it, if ever something happened to my office computer system, I could set up shop virtually anywhere with no information loss. This is the only way to have that kind of peace of mind. My tech investments have really paid off. The Microwize system saves me a lot of money, but even better, it saves me a lot of time, which is good because I need the practice.